Hi, I'm Dr. Kenneth Thean, and today I'd like to talk to you about body shaping and body sculpting. Many of us want to look good, which is why we go to the gym, we exercise, we go on diets, and even sometimes we visit the slimming centers. But very often, we don't get what we want. Well, science has an answer for this. The number of fat cells that we have in our body is pretty much constant after the age of 5. Which means when you put on weight, you don't increase the number of fat cells. What actually happens is these fat cells get fatter. When you lose weight, you don't decrease the number of fat cells. These fat cells just get smaller. But because each cell must have a minimum mass and we must have fat in our bodies, no matter how much weight you lose, sometimes there's this lump of fat which never goes away. Also, when you lose weight and you put on a little bit of weight, the same stubborn areas are the first to put on fat. All of us know this. Well, research has shown that fat cells are more fragile to cold and to heat. They die more easily, whereas cells that contain water, like skin cells, muscle cells, nerves, don't get damaged by cold and heat. Think of it this way. Take a glass of water, put a piece of butter inside, and put it in the fridge. The butter gets hard, but the water just gets cold. Now, I can easily break up these pieces of butter and the water just sloshes around. Research has also shown that fat cells are more fragile to prolonged heat. So if I take a fat cell and I heat it up to above 45 degrees for a prolonged period, the cell also dies and the body excretes the cell as part of its natural waste removal process. This technology has been around for a long time. 1980s, in fact, Harvard Medical School discovered that prolonged freezing of the fat cells results in permanent destruction. Over 50 peer-reviewed papers have shown 18 to 22% fat reduction after 2 cycles, and 80 to 90% satisfaction rate, and the fat reduction is long-term. The studies are up to 9 years. For heating of fat, laser thermolysis, the results are pretty much the same. A few points I'd like to make. This is not a weight reduction or a slimming program. This is a medical body sculpting treatment. You're not going to lose a lot of weight. You don't have to go to the gym, spend hours there. You don't have to go on a severe calorie-restricted diet to look trim. You're just taking a little bit of stubborn fat from the areas that you don't like. You're not going to lose a lot of weight because fat doesn't weigh a lot. Most of our body weight is in our bones, muscles, and other organs. This is a medical body shaping and sculpting program. It requires careful analysis of your body and an artistic approach to get optimal results within the constraints of your body. Safety and results are very, very important to get you the best shape that you want. Choose a dedicated center that is really interested in body shaping and sculpting with the full range of machines, FDA approved, full range of applicators, both the fat freezing and the laser thermolysis machines, radiofrequency, and high-intensity ultrasound. Remember, I am sculpting your body. The more tools I have, the better a result I can give to you. Choose the FDA-approved machines. They have a much longer safety profile, over 50 peer-reviewed papers, and more than 7 million treatment cycles. So we really know the machines very well. The fat freezing machines are very good for soft, pinchable fat. And the laser thermolysis machines are good for the more fibrous fat. Having both lets me shape and sculpt the body better. Also, the laser machines tightens the skin and can even out irregularities. Some people have fat cells that are very cold resistant. These same fat cells are more sensitive to heat. And the converse is true. Heat-resistant fat cells are very sensitive to cold. Having both lets me get better outcomes. Another very common question I get asked is, what happens if I put on weight? First, most of us are really consistent in our weight as long as we're not going onto a weight reduction program. And even if you put on a little bit of weight, the proportion is still there. So your waist gets a bit bigger, your hip gets a bit bigger, the hourglass figure is still maintained. And when you get back to the original weight, you will have exactly the same results as after the treatment. The best thing is that it involves no surgery, no pain, no downtime, no anesthesia, no scars, a very safe procedure. Results are seen in about 1 month. Optimal results in 3 months. You may need a repeat treatment after 1 month, and results are long-term and very satisfying. You can go back to your normal activities immediately. Men really like this treatment. And let me start with the areas which I can do for males because I really like this treatment. Double chin. Very effective for men because this turkey neck makes you look a little bit old. Shrink the double chin and the neck looks very much better. Another very common area for men is behind the back. That lump of fat makes your jackets, your shirts not fit well. Taking away that lump makes the shirts fit much better. Waistline. All of us want this V-shaped body and the love handles just bulge out above the pants. That can go down and you get a much nicer, slimmer waist. Another area which men really like, and this is more for the gym goers, if they've got a nice flat stomach but they don't get that six-pack. We can really take away that little bit of stubborn fat in front of the abdomen and the six-pack comes out. For men who really don't have that six-pack, we can flatten the stomach so it's a little bit flatter. One area which is a bit sensitive for men is really fat men have gynecomastia. That's the medical term for breasts. And by putting an applicator there, we can shrink the fat so the chest looks more masculine. For women, slightly different. Same double chin, so that's the area, but women have lumps of fat in the front, around the bra, and at the back. So when they wear something tight, it sticks out, and that area is very effective in being removed by this treatment. Also the arms. As you get older, you get what is called auntie arms or bye-bye arms, and this area can be shrunk very effectively. 1, 2 treatments and say bye-bye to bye-bye arms. Waistline. The flanks. Everybody wants the hourglass figure. And just by reducing a little bit of fat around the flanks, the waist comes in and instead of a straight line, you get the hourglass figure. Moving on, we have the front, the tummy, and the back fat. And those are 2 areas which are nice to treat. For tummy, it's very good, especially after childbirth and after cesarean operation. Legs. Nice, slim legs. We can remove the saddlebags along the outside, fat on the inner thigh, and even the back of the thigh, and that lifts up the buttocks. Very nice. Some women have fat around the knees, and that's also a nice area to remove fat. When we treat the legs, the cellulite also becomes less prominent. I hope you found this educational video informative. For more information, please visit my website at www.ensoulclinic.com, and if you like, press the subscribe button.